This is Where We Live from Connecticut Public Radio. I'm Lucy Nalpathanchel, broadcasting from my house as many of us in the newsroom work remotely. The number of COVID-19 cases continues to grow across Connecticut, despite Governor Lamont telling residents to stay home. It's been 1 week since his executive order went into effect, directing all non-essential businesses and not-for-profit entities in the state to close. But how are Connecticut municipalities responding to the pandemic? Today, Where We Live, we talk with New Haven Mayor Justin Elicker about his city's response. The Elm City has deep ties to New York, a region that has more confirmed cases than any other place in the country. We find out how the mayor's working to slow the number of cases in his community and learn about measures he's put in place to help residents. Do you live in New Haven? What questions do you have for Mayor Elicker about the city's response to this pandemic? You can join us, 888-720-9677. That's 888-720-WNPR. As always, find us on Facebook and Twitter at Where We Live. As we've done in previous weeks, our guests are joining us remotely as well. Mayor Justin Elicker, again, the mayor of New Haven, joining us via Zoom. Mayor Elicker, welcome back to the show.
Good to be here. Thanks so much, Lucy.
Also with us for the hour is Dr. Mehul Dalal, who's the Community Services Administrator for the City of New Haven. He oversees the Health Department and Social Services Department for the city. Dr. Dalal, welcome to the show.
Thank you, Lucy.
I'll start with Mayor Elicker. I spoke with you last year when you were running to be the next mayor of New Haven. I can't imagine that this pandemic was something you ever thought you'd be dealing with in your first term.
I knew we'd have a lot of challenges, but I don't think any of us imagined that this would be the challenge that we would all be facing. I think one of the nice things is the entire country is going through this together, and that's a real opportunity for us to lean on each other and learn from other cities that are doing creative things to address the problems.
When we talk about everyone working together to deal with this pandemic, tell me, how often are you in contact with your many employees, and what has it been like the last 2 weeks?
Well, actually, speaking in particular about collaborating with other communities, we have calls. I have calls with the other mayors of large cities in Connecticut on a regular basis: Bridgeport, Stamford, Hartford, and Waterbury. And also we, from time to time, have calls with our regional towns around New Haven. And that's been hugely helpful as we've implemented a lot of orders to restrict the grouping that is happening in our cities. If we do things together, not only does it help us get the right outcome, but it also helps us from a health perspective, because if only one of our towns limits the restriction on movements, but the other towns don't, it doesn't do as much to fight the virus. As far as communication with our employees and residents, almost every night I'm doing a robocall to all of our residents with updates on what the city's doing, updates on some new orders restricting movements. And I think that's really important, particularly in a time where a lot of people are really afraid and there's a lot of uncertainty. Making sure that we have that direct communication with residents is critical.
You mentioned some of the big cities. What about North Haven, West Haven, Hamden? How do you collaborate and talk with those municipal leaders?
Well, we've done conference calls with the towns around New Haven as well. And that's been helpful. Obviously, we don't always share exactly the same issues because a lot of the towns around New Haven are much more suburban. But overall, we have been communicating and doing conference calls, and I think that is helpful to make sure that we're in line with each other and collaborating. And also, there's a lot of things that we can learn from each other. Just to give an example, we've been in a lot of communications with Hartford and been struggling to make sure to support individuals experiencing homelessness. And this is actually a very big topic as a part of the pandemic, because we want to make sure that individuals are able to self-isolate, that there's not a spread of the virus within the homeless population. And we're looking at a lot of different strategies to address that, I hope we can perhaps talk about. But in particular, working with some of our other cities like Hartford has given us some ideas on how to approach this in a more effective way.
You can join our conversation with Mayor Justin Elicker, the mayor of New Haven, especially if you're a New Haven resident. If you have a question for the mayor, the number 888-720-9677. That's 888-720-WNPR, or find us on Facebook and Twitter at Where We Live. Before we talk about some of the measures to protect, as you mentioned, the homeless population, I wanted to find out just right now, what do we know about the number of cases in New Haven? Dr. Dalal, can you pipe in?
Yeah, absolutely. There's about 2,000 cases in the state of Connecticut. We counted 71 in New Haven. And we believe that in terms of the number of cases, we're on kind of the scary part of the curve. We think we're going to be experiencing an exponential rise in the number of cases over the coming days. They're predicting a peak in mid-April, but again, that's just a prediction. It depends on a number of factors, including some of the measures that Mayor Elicker and the other towns in the state have put in place a week ago or 2 weeks ago. That's what's going to determine how sharply our cases peak, and it's going to also determine how overwhelmed potentially our healthcare system will be.
So tell us more about the cases in the city of New Haven, Dr. Dalal. I understand there have been at least 2 deaths of the people that have COVID-19. Are they mostly elderly? Is it a wide range of ages?
It is a wide range of ages in terms of the number who have been impacted, as is the case globally. Those with more severe disease and the deaths have skewed into the older age range. That is what is expected based on the nature of the disease. So yes, we've had 2 deaths. One is in more of a middle-aged person, and one is in an older person.
I asked that for that clarification, Mayor Elicker, because when we think about the importance of social distancing, people thinking they might be not in danger of this because they may not be a senior citizen, what can you tell your residents about the importance of taking this seriously, no matter your age?
Yeah, this is something that I have just pushed out over and over and over again, that even though someone might not be as susceptible to some of the severe health impacts because of their age, they will spread it to many other people, including folks that may have a compromised immune system or are seniors. And so it's very, very important that every single person follows the directions that we're providing to do social distancing, kind of hunker down at home, not interact with a lot of people, because this is, I think, one of the only times in my lifetime where literally every person has a role in helping either spread or stop the spread of this virus by their own individual actions. And in some ways that's kind of scary because we're reliant on so many members of the community, every member of the community, to help protect us. But also in some ways it's really inspiring to see just how many people are heeding these warnings and trying to do their part to keep so many members of our community safe. I think that we've seen a lot of, or we've seen some groups that aren't paying attention. You know, we just closed down playgrounds yesterday, for example, because we've had a lot of congregating around playgrounds. In New Haven, we restricted the number of individuals or kids that could be at a daycare. And those types of things, even though the virus doesn't have, in general, as severe health impacts on children, children can spread the virus. And that's why we've been pretty aggressive at limiting the number of groups that people are allowed to gather.
You mentioned closing down playgrounds at schools as well as playgrounds at parks. So what happens if residents aren't following that? How will you be enforcing this?
Yeah, this is a tough question. I think that because a number of our playgrounds don't have fences around them. And so we'll send a police officer out and the police officer will ask people to disperse. You know, we're not arresting people or fining people at this point. If it continues to be a problem, then we may explore fining people. But at this point, I think the very fact that there's a sign up at the playground that says it's closed, and if someone comes and asks people to leave, we've found that people have been complying with that, and that there isn't a major problem once there's that rule out there of people following these directions.
You can join our conversation with Mayor Justin Elicker. He's a first-term mayor in the city of New Haven. If you live in the Elm City, we want to hear from you. How would you rate the city's response to trying to slow the spread of COVID-19? Join us at 888-720-9677. That's 888-720-WNPR, or find us on Facebook and Twitter at Where We Live. Pat's calling from New Haven. Pat, go ahead.
I think the media have provided lots of coverage of the city's and the Board of Education's efforts to provide meals for the children of the city. I'm wondering if you could talk about what is being done by the city to reach out to older adults, particularly the ones that use senior centers and rely on the midday meal as an important part of their basic nutrition. But just in general, what is the city's strategy for reaching out to older adults who are the most vulnerable population?
Pat, thank you for your question. Mayor Elicker.
Dr. Dalal, do you want to take this one? I'm happy to do it, but you have been working a lot more on this.
Yeah, the older adults is a very special concern, so I do appreciate the caller's question. We have been very clear in our messaging for older adults that they should stay at home, because if they do contract COVID-19, their risk of a more severe course is much higher. This poses a special challenge when the older adults are relying on basic needs. So we fully recognize that that's the case. So what have we done so far? We have, because our schools are out and our public health nurses do not need to staff the schools, we have reassigned our public health nurses to make calls to older adults throughout the city. And based on those calls, we'll be assessing citywide what the basic needs and basic information needs, as well as goods, foods, and other essential needs will be for the older adults. And we'll take action based on what we find citywide. We also have our senior centers, which were closed along with the schools over 2 weeks ago. And we are transitioning that program to make deliveries and pickups in a way that is safe for the seniors with respect to social distancing guidelines while the food is being distributed. It is very important that for this population that we do this right. So the transition period requires a little bit of planning. We have planned that, and that will be implemented, I believe, this week.
Dr.
If I could add some,
go ahead, Mayor Elicker.
Some other points there, and it's good to hear Pat's voice. She actually used to work with seniors in New Haven in her role in the city, so it's nice to hear her calling out. We also are very, in particular, concerned about nursing homes, because this has been a major problem in other states where we've seen a very vulnerable population. And also not just nursing homes, but areas where there's a concentration of seniors that are living, but they're living independently. And in particular, we've been focusing on Bella Vista because there's about 2,000 people that live there, and it's not as restricted of an environment. We've had a lot of conversations with the management company there. They've increased some of their security to make sure that there are not unauthorized visitors going on and off the site, so that we can reduce the number of people that potentially might be exposed. They are working closely with Fairhaven Health, which has a site at Bella Vista to check on residents and provide support if residents have symptoms of COVID-19 or do end up testing positive.
As of now, are there residents at Bella Vista that are positive for COVID-19? I ask because in my town of Suffield, there is an assisted living facility as well as a skilled nursing facility where there are now a number of cases among elderly and some of the staff. This is probably a big concern for you, because once somebody gets it, it's highly contagious.
Sure. So my understanding is there is one resident, but that resident is still at the hospital and has not returned to Bella Vista.
Dr. Dalal, when you were talking about the emphasis and making sure that getting food to the elderly and others around the city in a safe way, I was also thinking about just efforts to reach people when we think about mental health, whether it's someone who's elderly or not. This is a very stressful time for a lot of people when you think about having to self-isolate, to stay home. Not everybody has family or are good neighbors nearby to help. I'm just curious how the city hopes to address those needs as well.
Thanks, Lucy, for that question. That is so important these times. Again, this type of situation is unprecedented, and we are asking people to stay at home. So social distancing also for some can mean social isolation. We are trying to be very creative in how we promote social connections during this period. We have the advantage of having a large number of nonprofits and healthcare systems that have focused on mental health throughout their history and decades in the city. So they know the city very well. So we have partnered with Clifford Beer's Clinic, United Way. They are looking to stand up what is something called a warm line. A warm line is not a hotline with respect to COVID specifically, but with respect to individuals and families that may need some additional support with respect to their mental health. So we worry a lot about individuals with pre-existing mental health conditions, but there's also the conditions that are brought on by the stress related with this. Anyone can suffer from stress-related reactions related to this scenario. So I encourage folks to look at guidelines that the CDC has put forward. It's not usual to be staying at home with your kids for a long period of time, as many listeners may know. And you need to have a different set of coping strategies with respect to how you do family time, how you set limits with your kids. All of this is very important. And I think we should be tapping into telehealth technology, video conferencing technologies to help maintain those social connections.
And Dr. Dalal, if someone doesn't have that kind of internet or technology at their home, how then can they be checked on?
We would rely on the telephone, to maintain that connection. We do not want to promote people visiting because that's one primary way that this spreads. I know it's very tempting and sometimes seems very necessary, but one has to be very careful, especially if you have an older adult, that limit your visits to those individuals because if they do get the disease, their risk of having a severe course of disease is very high.
You can join our conversation, 888-720-9677. That's 888-720-WNPR. We're focusing on the response in the city of New Haven. You just heard Dr. Mehul Dalal, Community Service Administrator for the city of New Haven. And with us as well, Mayor Justin Elicker. Alam is calling in. Alam, what's your question?
Is this me?
Yes, go ahead.
Yes. I'm an alderman here in New Britain, Connecticut, and in the city of New Britain, the mayor requires all employees to show up to work in City Hall. I believe it's pretty much puts them in danger. What's the policy in New Haven regarding city employees and who is considered essential or not?
Mayor Elicker.
So there's a mixture of strategies that we're using. We have a lot of employees that are working from home, and we provided them with devices. We still have some employees that we're deeming as critical. And unlike a hurricane, say, there's a different type of employees in this type of health emergency that might be deemed essential. For example, we still have refuse pickup. We still have emergency inspections if there's a problem with an apartment. But we've changed a lot of the ways that we're doing business to allow residents and our employees to interact remotely. A lot of our higher level staff is working from home, and much of the work that we're doing doesn't actually need to be, you don't actually need to be physically present. So it's a real mix of our approach. There's also, we realized pretty quickly, it's complicated from a union and labor perspectives, and we have a labor director that's worked very hard to work through these issues in a quick fashion to make sure that we're doing things in collaboration with the labor unions.
This is Where We Live from Connecticut Public Radio. I'm Lucy Nalpathanchel. We're going to take a quick break, and we'll be back shortly with Mayor Justin Elicker, who leads the city of New Haven, as well as Dr. Mehul Dalal, the Community Service Administrator for the Elm City. You can join us too, 888-720-9677, or find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. My guest today, New Haven Mayor Justin Elicker and the city's Community Services Administrator, Dr. Mehul Dalal. If you're a New Haven resident, we want to hear from you. Do you have questions for the mayor and Dr. Dalal? If you are living in New Haven and you're trying to do your best to stay at home but have questions about the measures in place to protect your community, you can join us, 888-720-9677. That's 888-720-WMPR, or find us on Facebook and Twitter at Where We Live. Mayor Elicker, we know that first responders, healthcare workers, they don't have the luxury to stay at home. They have a very important job to do. It's also very dangerous for them. I'm curious what is going on in terms of the number of first responders who are showing symptoms and how quickly are they being tested?
This has been a major focus of ours. And we're coming at this in a variety of ways. As you know, many people or many cities in all around the U.S. are very focused on PPE, personal protective equipment, in particular N95 masks. And our team has been working very hard to identify potential sources of safety equipment so that we can keep our first responders as safe as possible. It's been one of the things we've worked on a lot. And you're right that the first responders, in particular police and fire in New Haven, are on the front lines of this. And we're doing a number of things to work to make sure that they're as safe as possible. Unlike a lot of communities, New Haven's fire department will respond to every medical call. We keep track of COVID positive cases and their locations in New Haven as quickly as we can get them, so that the fire department knows when they're visiting a home, whether there's a suspected case. And we want to make sure that if our firefighters or police officers do get exposed or are symptomatic, that they have a place to go, so they're not exposing their family. And so we've been working with the University of New Haven and we should go live this week, later on this week, to have housing for our first responders that may indicate symptoms or potentially be exposed to COVID-19. Once our first responders do test positive, and a couple of them already have, if they do not have the option to self-isolate at home, we have a facility set up for them so that they can isolate as a group in New Haven while they get better.
You mentioned collaborating with the University of New Haven. You had also reached out to Yale. At first they said no. Now they're offering up 300 beds. So right now you're working with UNH to have this facility ready for first responders. But down the road, would you take up Yale's offer as well?
I think that it's good to have a lot of different options out there. We've been in conversations with other universities as well. And there's a lot of different types of potential housing that we may need. For example, similar to needing to promote self-isolation of first responders that may be exposed but have not yet tested positive, we're interested in some housing for individuals experiencing homelessness that may have been exposed, but we do not know if they do or do not have the virus. And so that's another option where housing where people are allowed to separate and self-isolate is very important. I appreciate the university opening up the rooms for that possibility, and we're looking at all the options available right now.
Tell me, Mayor Elicker and Dr. Dalal, who's also with us, a Community Services Administrator for the Elm City, how are you working with Yale New Haven Hospital? It's a major hospital system right in your community. We're hearing that when this spike continues, if there is a surge and demand in hospitals, that these hospitals are going to need other places to have hospital patients who may not have COVID but still need to be treated. Tell us what that coordination is like and what are some of these other alternate places, Mayor Elicker?
I mean, I can take a first stab at it and see if Dr. Dalal has something to add. The hospital has been very, very collaborative with us. We have a daily call with partners in the region that includes the hospital, other healthcare, community healthcare facilities, and so on. And the hospital has been very supportive. We're working at fast tracking the testing for our first responders. There's been a real delay, not in the actual testing, but getting the results. And they're working very hard to speed up the results so that we can find out as quickly as possible. if our first responders do or do not have COVID-19, so we can get them the help that they need and make sure that they're not putting others at risk, as one example. But we've also been collaborating in a lot of other different ways. We've been in communication with the hospital about a site that we're trying to stand up for individuals experiencing homelessness to isolate as a group if they do test positive for COVID-19. I've generally been very appreciative of the hospital's work and communication with us.
Dr. Dalal, did you want to add to that?
No, I think that covers it. Thank you.
Speaking of the homeless population, you referenced this earlier, Mayor Elicker. I believe the Commissioner of the Department of Public Health has asked municipalities and other places to make sure that for people who are homeless, that again, there are alternate locations for them so that they're not all close together and housed. And so tell me how that has been working out for you.
I'm going to let Dr. Dalal answer this because he's been working tirelessly on this, but I did want to add one other part to your previous question. So the hospital has been working hard to add beds. As we've seen most closely to us in New York, the healthcare system is totally overwhelmed, and that's multiple parts. It's the number of beds, it's the number of staff that can support those beds, and then equipment, in particular ventilators. And the hospital has been working hard to, number one, clear out beds in the hospital that, for example, people that don't absolutely need to be there. And then second, they're looking at, because Yale New Haven Health is a larger network of hospitals, looking at the potential to transfer some patients, if they get overwhelmed in New Haven, to some of the other regional hospitals. They're also looking at some of their ambulatory care units as a way to increase the number of beds. And I know that there's some exploration of a surge facility or a surge hospital, presuming that we get to this point, so that there's more beds available, even beyond the infrastructure that we already have. But with that, let me hand it over to Dr. Dalal to talk about our approach to homelessness.
Yeah, thanks, Mayor, and thanks, Lucy, for the question. The homeless population is a very high-risk population, and the reason that is that in typical settings in shelters, there can be many individuals in a single room, and it is virtually impossible to practice the social distance, which is so important in terms of mitigating the spread of the disease. So we instituted a program over a week ago, as we knew that this epidemic was going to hit New Haven, to decompress the shelters. So we went ahead and identified a large number of individuals, 84 in total, that could move from a sheltered environment to individual hotel rooms. So we're glad we did that, but there's, as you know, New Haven has a large homeless population, over 500 unsheltered by last count. That's probably an undercount. And so we have a lot more room to go with respect to decompressing our facilities that typically house the shelters. I'm very appreciative of the order that came from the Department of Public Health. That was a really necessary step. It signals that it's very important that we focus on this population. The homeless population is also at high risk for severe or even critical disease if they do get COVID. So we want to make sure that we reduce the risk for these individuals as much as possible. People may not know, but the demographic profile of homeless individuals has shifted over the years. We see a lot more people in the older age groups, which are already predisposed to having severe disease from COVID. And of course, we have individuals who have immunocompromising medical conditions or chronic conditions, which again, predispose to more severe consequences.
You can join our conversation. You're hearing Dr. Mehul, the Community Services Administrator for the City of New Haven. Also with us via Zoom, the Mayor Justin Elicker of the City of New Haven. Join us 888-720-9677 or find us on Facebook and Twitter at Where We Live. Jamie's calling from New Haven. Jamie, you're on the show.
Hi, thank you. Mayor Elicker, I was wondering if we had any plans to close some of our city parks here in New Haven. We have some really wonderful parks, and especially as the weather is getting nice, I've noticed over the last week or so a lot of people taking advantage and using the parks. The other day I drove by the parking lot in the back of East Rock Park, and it was overflowing. So obviously I know everyone would like to be outside, and was just wondering if you had any plans to limit the amount of people or close the parks altogether.
Thanks for the question. And this is an issue that we've been really struggling with. I've been getting reports and text messages from people all around the city about large groups congregating at parks. That was one reason why we decided to close playgrounds yesterday. As far as parks goes, we've taken some actions to limit congregating at parks. We put up the chains so that there's not large numbers of people that are driving into the park. Many people have cut the chains. We've removed basketball nets. We've removed tennis nets. We don't want people to stay cooped up so much that they can't even walk outside to exercise, but people have to stay away from each other. And the issue with parks is it's very hard for us to just close parks because our parks in New Haven don't have fences around them, and many of them we're blessed that many of them are very, very large. But it's very important that people don't gather in large groups. And so if people do see large groups in parks, they can call the police department non-emergency number, and an officer will come out and just ask people to disperse. That is actually very helpful. This is a time when people really have to follow the directions that we've been giving. And do their part, their civic duty to protect all the people in the community. It's an issue that we're really struggling with on how to address, and a combination of taking away some of the facilities to reduce people's likelihood of being there, and also public outreach is one thing that we're doing. We also have police cars with loudspeakers that have my voice on them, reminding people not to congregate in large groups. So we're trying a number of different strategies to address this issue.
Mayor Elicker, the weather is just going to keep getting nicer. And so when you say that you're struggling with this now, I can't imagine if we're still waiting for this surge in cases to come the next month or so, that this problem is going to go away. It might even worsen. Nancy wants to know, what advice and guidance do you have to safely get outside? Because getting exercise, getting fresh air is important.
Yeah, I mean, I can talk about my own personal conduct is that I often go running, and I'll choose a route that I know it's not likely that I'll have to be close to other people. Sometimes I even step off the sidewalk and out in the street a little bit to avoid people. I think people just need to be smart about it. My wife and I have 2 young children, and we talk to them about how now is a very special time where we're not supposed to go and hug other people and get close to other people. I think these are very counterintuitive to our nature as humans. And that's one of the reasons why it's very difficult for people to change what is culturally ingrained in us. But it's so critical that they do so.
We know that there is a lot of focus on young people, especially with distance learning. I imagine that there are many schools in New Haven that have just started that up today. But in terms of the weather warming up, and once they're done with their work June 30th, how do you make sure that kids are engaged and not getting themselves into trouble? It's something that happens in certain areas and around our country, especially when the weather warms up, Mayor Elicker.
Yeah, this has been a topic of conversation, not just after quote unquote school ends, right? Because it doesn't even feel like there's an active school regime right now, but even today. And actually, my wife just texted me photos of my daughter. Today, the New Haven Public Schools has launched their online education system, and my daughter's on her iPad doing some exercises that the teacher gave to her. I've been very proud of New Haven Public Schools and the work that they're doing. This is a very difficult situation where New Haven has a lot of challenges with online learning. There's many, many families that don't have access to devices. Our public school system has distributed around 5,600 devices to families to make sure that they can do some online learning. It's not many, but some families don't have access to Wi-Fi, and there's an effort to let families know about reduced cost Wi-Fi that some of the Wi-Fi providers are implementing. but there are some individuals, particularly high school kids, that we generally have a youth stat program and a youth outreach program that works to support individuals that are very high risk for getting involved in violence and that sort of activity. And it's much more difficult for our street outreach team to interact with young people when they can't physically do so. They've been doing so on the internet and also via phone to try to be very proactive to reduce the likelihood of there being problems. When there's not a lot of structure during the day, it's easy for people to go off track. And so we have a number of individuals in the youth department and nonprofits that we're partnering with to give this kind of support that we can as best we can, and given the difficult infrastructure problems that we have right now, to support kids that may be struggling.
Before we head to break, we heard from Sarah on Twitter. She asks Mayor Elicker, please appeal to the office of Governor Ned Lamont to change the exception that currently allows groups of up to 50 people to meet for religious purposes before next Sunday. And so what is the latest in terms of people who are religious and want to somehow find a way to meet? I mean, what is the guidance that you're telling your residents in New Haven?
Well, so our team has spent a lot of time doing outreach and collaboration with pastors. Dr. Dalal and Director Maritza Vond, our health director, hosted a call where there were over 130 religious leaders and pastors, hosted a Zoom call about a week and a half ago in order to collaborate and inform the community about why it's so important to not gather in groups, to practice social distancing. Our religious leaders are those individuals that many, many people in our community look to for guidance and support. And in this time when people are really struggling, there's a strong need for that kind of spiritual guidance. So it almost feels counterintuitive for us to be asking people not to physically go to church. I know that many of the pastors are doing remote services, which of course is not the same, but it's the best we can do now. We've been very collaborative. I don't know if Dr. Dalal, you have anything to add on that, because I know your team has worked hard to do that communication.
Yeah, we've in addition to what the mayor mentioned, we've developed a detailed Q&A information sheet for our religious leaders in our community. And we've really relied on messengers in the religious community to help us, not just in terms of spreading the message, but having concrete technical support to those religious institutions that may not be familiar with teletechnology. We are partnering with the Yale Divinity School. Some of the religious leaders there have offered other religious institutions technical support on how to stand up teleservices. And in addition to that, we have provided guidance on how donations can be made online. Many of our religious institutions in our community rely on in-person services for operating expenses. So we've provided technical support, or our partners have provided technical support with respect to how to maintain the donations during this time.
You're listening to Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. With me via Zoom, Justin Elicker, the mayor of New Haven, also Dr. Mehul Dalal, the community services administrator for the city of New Haven. He oversees the health department and social services department. Now, if you live in New Haven, we want to hear from you. Are you a first responder, a teacher, a business owner in the Elm City? What questions do you have for Mayor Elicker? Join us, 888-720-9677, or find us on Facebook and Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Today with us via Zoom, the mayor of New Haven, Justin Elicker, also Dr. Mehul Dalal, the city's community services administrator who oversees the health and social services departments. You can join us, 888-720-9677, or find us on Facebook and Twitter at Where We Live. Arthur's calling from New Haven. Arthur, you're on the show.
Yes, hi. I wanted to ask the mayor I know it would be a tough call, but which charity in New Haven should be a person's highest priority when thinking about making a contribution?
That's like asking what's my favorite pizza place in New Haven. I can't have a favorite, right? I would answer that there's this time we've seen huge sacrifices by the business community. Basically, most businesses are shut down at this point, and they're really struggling. And also on the nonprofit side, there's a very almost ironic situation where nonprofits have been hit very hard with their ability to fundraise. There's not as much money in the community right now because so many people don't have a regular source of income. People that are reliant on their jobs, you've seen unemployment skyrocket, and those people would be donating to nonprofits. Nonprofits are unable to host their gatherings and fundraisers, things like that. But at the same time, this is the most important time for our nonprofits to be actively supporting the community. And so I would encourage people to look at what they care about and invest in what they care about. I know that there's a lot of people that are concerned, in particular, about groups that don't have the kind of resources that others do, the homeless population, the undocumented population. And so those are areas where I think there's a potential for people to make a strong investment. Our healthcare providers out there, particularly our community health centers, are doing incredible work and putting their lives at risk. And so that's another area where I think that there's a lot of opportunity to support. And then I think we're seeing a lot on the emergency food providers. There's been so many groups that usually have food pantries and have been continuing to do so. The city's released some guidance about how to do that in a way that practices social distancing and ensures the sanitation of things that are given out so that people don't spread the virus. So I would urge you to look around and find that nonprofit that you feel is inspiring in the way that they're doing work through this crisis.
Mayor, just briefly, when you mentioned how people can still contribute to food kitchens and do it in a way that's not spreading the virus, can you tell us briefly what that guidance is?
Can I hand that over to Dr. Dalal because he's been working on that?
Absolutely. Yeah. So typically when we distribute food, there's a set of normal sanitation practices that one would follow just to make sure that the process of the food distribution is healthy. In the era of coronavirus, we have to enhance those practices substantially. So the primary principle is social distancing, so which means that if there's a queue that forms with respect to the pickup of the food, we should make sure that the queue and anyone in the queue is standing 6 feet apart from each other. To the extent possible, we should avoid queues by staggering pickup times. These are just some examples of strategies. Anyone who's distributing the food should, again, have an enhanced set of personal precautions with respect to how they're doing it. So even the workers who are distributing the food should be 6 feet apart from each other, and they should be wearing gloves while they're handing out the food. The food also should be packed and not in an open format container. So many of our nonprofits who have done this work for decades in New Haven have been admirable in how they've shifted their practices on such short order. So my heart and gratitude goes out to those organizations.
Mayor Elicker, we know that unemployment claims are surging, not just in Connecticut, but around the country. Peter wants to know, what can your city do to help tenants who have lost their jobs and now cannot pay their rent?
Yeah, this is a really challenging situation, and I'm very happy that the federal government approved the stimulus package. The state as well is providing some resources, particularly to local businesses, in the form of loans. And I think in the first 24 hours of their program, they had to stop the applications because they received so many, which is an indication of just how significant the problem is. In New Haven, what we're trying to do is promote through our economic development department people buying things locally. If they're thinking about buying something online, think about, is there an option locally, a gift card? There's a lot of restaurants that are still delivering and doing takeout. And so we're encouraging that. The federal stimulus package, my understanding, provides support for businesses if they rehire or continue to pay their employees. So that's something I think is very critical to keeping all of us as much as possible whole through this crisis, so that when it ends, we can hit the ground running. And the state has also put a moratorium on evictions, so that people that are unable to pay their rent can not become homeless, which would contribute to the spread of the virus, as we've talked about, because of the challenges of self-isolation and making sure that individuals are not congregating in large groups, which happens inherently in some of our homeless shelters.
We just have a few minutes left. Someone did call in from another town, Mayor Elicker, but she's someone who is over 70. She has different medical conditions. Relatives have been able to help her out now with groceries, but she worries about people who can't travel, that may be cut off from trying to get resources like food. So for people in your city that are struggling with that as well, that have food right now but are worried about the next couple of weeks, and what if one of their family members can't help them at that time? I mean, how will the city of New Haven reach them?
So Dr. Dalal and his team are working on an infrastructure for providing basic needs to people for just this type of situation. As you can imagine, for the entire city, our ability to support everyone in the city is very challenging, but the team is working to do that. I don't know, Dr. Dalal, you have anything in particular to add on that point?
Yeah, we are looking at that issue and attempting to figure out the best way we can address that challenge. Right now, our priority, of course, is the elderly population, because we want to do everything we can to support our older adults to stay at home, which means making sure that they can access their critical needs. The mayor mentioned earlier a partnership with Fairhaven Community Health Center and assessing and addressing the needs of the residents of Bella Vista. That is our priority right now. We are making sure, in partnership with them, that anyone in Bella Vista has some essential needs that they are met. And we do want to try to scale up that program as much as possible through the priority populations in New Haven.
Mayor Elicker, before we run out of time, could you talk about this Medical Reserve Corps that you've launched? Again, healthcare workers, first responders that do this each day. They're in harm's way. If they end up having to be quarantined for 2 weeks, we're going to need more volunteers. What are you hearing from people in New Haven after you put out the call?
So we had been struggling to identify people to staff some of the facilities that we're trying to stand up. And then we put out the call through the Medical Reserve Corps, which is basically a statewide system where people can volunteer in their community to do a variety of things. But our particular interest is people that have some sort of health background and expertise, whether it's an EMT or an RN or an MD. And within 2 days of us putting out this call, we had more than 200 people apply. Which I think is just an indication that people are wanting to step up and help their community, even if there is potential risk to that. We're very grateful for the number of people that have stepped up. We'll be processing these applications and reaching out to folks if they fit the right criteria as soon as possible, so that we can help them help us. It's inspiring that so many people have reached out and are interested in volunteering.
We're going to have to leave it there. I want to thank Mayor Justin Elicker, who leads the City of New Haven. Thank you for joining us via Zoom today, Mayor.
Thank you.
Also, Dr. Mehul Dalal, the Community Services Administrator for the City of New Haven. Dr. Dalal, thank you.
Thank you.
Today's show produced by Kerman Baskoff. Thanks to Kate Tolarski on the phones. Our technical producer is Kat Pastor. I'm Lucy Nalpathanchel. Thanks for listening.